I continue to work on parts of it that need more information. For me, one of them is about talking about what the cost is. You may know the cost for Medicare for All estimates vary by trillions and trillions of dollars. So I'm going to have a plan to talk about what the cost is, and I'm going to have a plan to talk about how we can pay for it.
That was Senator Elizabeth Warren today defending Medicare for All as questions mount about how the 2020 candidates intend to pay for the plan. While proposals vary, Medicare for All has come to mean a universal single-payer health insurance system. It's estimated to cost $30 trillion over 10 years. And a new report out by the Committee for a Responsible Federal Budget finds paying that sum will not be easy. It lays out 8 different options for financing. They include payroll taxes, income surtaxes, or value-added taxes. It could also be done if all individual and corporate income tax rates were more than doubled, or if a mandatory public premium was created. Finally, financing could be achieved through a reduction in non-health federal spending, an increase in national debt, or, quote, impossibly high taxes on high earners, corporations, and the financial sector. To break this all down, let's bring in Marc Goldwein. He is the Senior Vice President and Senior Policy Director for the Committee for a Responsible Federal Budget. Thank you so much for being with us, Marc. A lot of these options involve raising taxes. However, your report found increases on high earners and corporations couldn't cover more than 1/3 of the total cost. So where else would that money be found?
Look, the major expense of Medicare for All is eliminating everyone's premiums and deductibles. And so if we're going to have no premiums, we have to replace them with something. And at the end of the day, that's going to be some form of tax that affects the middle class, not just the very highest earners.
Well, we've laid out a few of the choices for financing the system. What are the biggest trade-offs when weighing the options?
Well, I think the biggest trade-off is progressivity versus efficiency. The most efficient way to raise the revenue would be to charge everyone a premium, but that would mean the low-income folks pay the most. The most progressive way would be some kind of, doubling the income taxes, for example, but that would put our top rate up in plus 80% plus, and we know that basically when you raise taxes that high, people just stop working. You don't actually get very much income out of it.
Well, your report found that regardless of its impact on national health care expenditures, a universal health care system would, quote, shift substantial costs from the private sector to the federal government. Can you break down for us what economic impacts there would be beyond the health care field?
Right. So there's the obvious disruptions that may or may not occur in benefits of Medicare for All. But whatever we do to finance it, that's going to have an economic effect. So, for example, we finance it with a 32% payroll tax. That means for every American, every dollar you earn, you're going to lose 32 cents, and that is going to be a disincentive to work. We estimated that it would reduce the amount of people worked by basically 9 million workers by 2030.
Well, Medicare for All, as you know, is taking up a large portion of the 2020 debate. What do you think folks are missing in their conversations when talking about this issue?
I think they're missing what they're going to do when Medicare for All fails, because there isn't the sufficient support among Republicans, for example. But we do have a major health care cost issues. Drug prices are too high. Hospitalization costs are too high. And the federal government is paying too much as well as families. So what we really should be talking about is how are we going to lower costs for everyone so that we can really afford the health care system we have.
So you analyze the data. Do you think voters are getting the information that they need to make an informed decision about this healthcare debate?
I think they're starting to. I think that it's encouraging that Senator Warren, as you mentioned, is going to have a plan for financing it because it's really important. To date, it's all a bit about the candy and not about the vegetables. But I think the public is starting to hear both sides of this.
Well, the Committee for a Responsible Federal Budget intends to provide a more detailed analysis about consequences of Medicare for All. When you're looking at the potential impacts, do any of the options for implementing a universal single-payer system appear more realistic than others?
Well, I think you'd have to do some kind of combination approach, maybe a smaller premium with a little bit of a payroll tax with a few taxes on high earners. I also think introducing back cost sharing so people pay a little bit in terms of co-payments and some real strong reforms to the healthcare system can help bring down that overall cost and make everything a little bit easier.
All right, Marc Goldwein in Washington for us. Marc, thank you very much.
Thanks for having me.